How do medical professionals ethically present before and after results? Have you ever wondered how medical professionals share before and after results ethically? This is especially important in fields like plastic surgery, where trust and transparency are vital. Medical professionals adhere to several key principles to ensure they meet ethical standards. First, obtaining explicit patient consent is crucial. Before using any images or stories for marketing or educational purposes, surgeons must get informed consent from the patient. This means the patient should clearly understand how their images will be used and agree to the sharing of their photos. Next, maintaining patient privacy and confidentiality is essential. Even with consent, medical professionals take steps to protect patient identities. This can include avoiding personal details and using techniques to obscure facial features. This practice respects patient confidentiality and complies with healthcare privacy laws. When presenting results, it is important to show realistic and balanced outcomes. Before and after photos should accurately reflect typical results without exaggeration. Medical professionals avoid using digitally altered images or selective angles that could create unrealistic expectations. They also provide balanced information about the benefits and risks of procedures to help patients make informed decisions. Another ethical practice is avoiding the exploitation of insecurities or promoting unrealistic body ideals. Ethical presentations do not suggest that happiness depends on achieving a specific body type or reversing aging. Advertisements should not promote unhealthy body images or imply that cosmetic surgery is a solution to emotional issues. Using before and after images as educational tools is another important aspect. These images can demonstrate the typical healing process and expected changes over time. Showing results beyond the initial weeks after surgery can provide a more accurate picture of lasting effects. Integrating psychological support is also vital. Ethical practices include psychological evaluations to ensure patients are emotionally prepared for surgery. Surgeons work with patients to set personalized goals, emphasizing that results can vary and perfection is not guaranteed. Lastly, medical professionals must comply with regulatory and advertising standards. They adhere to guidelines that govern healthcare marketing, ensuring truthful and non-deceptive presentations. This helps protect vulnerable consumers from misleading claims. In summary, ethical presentation of before and after results involves transparent communication, respect for patient rights, realistic portrayals of outcomes, psychological support, and compliance with legal standards. These practices help patients make informed choices and maintain trust in the medical profession. Always consult healthcare professionals for personalized advice and information.